When you hear the word migraine, you might just think bad headache. But migraine is actually a neurological disorder with a host of complex symptoms. A migraine headache can be debilitating, causing throbbing pain on one side of the head, nausea, and extreme sensitivity to light and sound. But here's where it gets interesting. No two migraines are the same. In fact, some migraines don't cause pain at all, but they can bring strange and sometimes scary symptoms. Migraines have 4 phases. The first is the premonitory or prodrome phase. This doesn't mean you'll start having premonitions about your entire future, but it's probably a prediction of the migraine headache to come. Symptoms in this first phase can include mood changes, difficulty concentrating, and food cravings. The second is the aura phase. And okay, this sounds kind of paranormal too, but this phase can be alarming because it may bring visual or sensory disturbances. Migraine aura typically affects your visual field. You may see a shimmering spot that grows into a crescent shape. You can also experience zigzag lines, flashes of light, blind spots, or even loss of vision. The aura phase can affect other senses too. Some people may experience tingling skin or difficulty speaking. Usually, aura is followed by the headache phase, but this isn't always the case. It is possible to have just one of the phases of migraine individually, so plenty of people have aura alone, without the headache or the post-headache phase. It can be frightening to experience aura for the first time. In fact, if you think aura symptoms sound like the symptoms of a stroke, well, you're not wrong. So how can you tell the difference between migraine aura and a stroke? In the case of migraine, visual aura usually starts gradually and lasts less than an hour. But vision loss during a stroke happens suddenly and can be permanent. Stroke symptoms often include face drooping, arm weakness, and slurred speech. Another helpful tip is to think of symptoms as either positive or negative. Migraine aura symptoms are usually positive, that is, added visual stimuli, like those bright spots, flashing light, and zigzags we talked about before. Stroke symptoms are negative, as in your vision or other senses diminish. If you are experiencing any of these neurological symptoms for the first time, it's crucial that you go to the ER immediately for a proper evaluation by medical professionals. They can help diagnose you and create a personalized treatment plan. If you are diagnosed with migraine, keep a diary of what triggers your migraines and what symptoms you have, and share it with your doctor going forward. New treatments and medication breakthroughs have opened doors to better migraine management. Consult with your doctor to learn more about how to reduce migraine's impact on your life.